Hello everyone, my name is Ashkan Eliasy and I am going to talk to you about cone shape change with keratoconus progression. The only disclosure we have is that Professor Olsheik is a consultant for Oculus. The purpose of this study is to evaluate the cone shape change with keratoconus progression using a new and validated method. This method was previously discussed in detail and published at Royal Society Interface, and further it was applied on clinical data and validated clinically, and this was also published at Journal of Refractive Surgery. Both of these publications are referenced on this slide. In the current study, which was a retrospective record review, all cases were examined with Pentacam HR. Significant progression was based on Pentacam ABCD system. 49 eyes were included in the study with up to 36 months follow-up. Cone features, including central location, height, and area, were assessed for all patients. Our findings showed significant change in the anterior and posterior surface of the conium. The anterior cone was changed on average by 20 microns, and posterior cone was changed by around 36 microns. This is consistent with other findings that the posterior surface of the cornea in keratoconic patients is deforming more than the anterior surface. On the other hand, we found no significant increase in the area of the cone for the anterior and posterior surface. This is suggesting that with the disease progression, the total affected area on the cornea remained almost unchanged. Our findings also suggest a small shift of the cone center towards the corneal apex. On these figures, you can see that the blue dots are indicating the location of the cone center on the first examination, and the red dots are indicating the location of the cone center on the follow-up examination. And both on the anterior and posterior surface, we can see that red dots are shifted more towards the corneal apex. We also found a high correlation between the change in the cone height and maximum anterior curvature. Further, we found high correlation between the change in the cone height and minimum thickness. This is suggesting with the increase in the cone height, the anterior curvature of the cornea increases and also the thickness reduces. So in conclusion, cone morphological changes were described in a longitudinal study. There was a significant increase in cone height, especially in the posterior surface, with a small alterations in the cone area. The cone center also shifted towards the apex with disease progression. Thank you for listening, and please do get in touch if you would like to learn more about our study.